All right, everybody, welcome back to Psychiatry Unboxed with me, the Geek Shrink. I have a wonderful guest, somebody I've been wanting to talk to for a bit, Dr. Courtney Tracy, who also goes by the Truth Doctor on all the lines, all the internet stuffs. So very, very excited to talk to her. I think we're gonna have like a fun discussion, a revealing, hopefully, discussion. And I'll let her introduce herself first, and then we'll kind of go from there.
Well, thank you so much for having me. It truly is an honor to be speaking to your audience. I'm Dr. Courtney Tracy. I'm a licensed clinical social worker and a doctor of clinical psychology. I've specialized in co-occurring disorders, substance use, and mental health for over 10 years. And I consider myself to be a clinical entrepreneur. So while I am a clinician by trade, I pride myself on developing programs and facilities that have a human first component and see both the clients and the staff as people before the means to profit.
Yes, it is definitely something that I've appreciated about like following your journey online. I love seeing that you're saying that you're in your new office in your new treatment center, which is like a huge deal. Tell us a little bit about that before going forward.
Yeah, well, I mean, I'm sure we'll talk about my journey, but where I
Yeah,
am today is doing this interview at my newest treatment center called Exist. And I called it that because for a long time and pretty frequently, I feel like I don't want to. And I know so many people that feel that way too. And so it's an honor. We open in about a week. So, like, to be here with my new staff and to be preparing to treat clients is I'm at a place that I wasn't sure I was going to get to in my
yeah,
life.
which I think is so huge, and I think like just yeah, we'll talk about the journey and stuff, but like being able to kind of give back and open up a facility, a treatment center that's going to be, with your own unique perspectives is like so valuable. So best of luck with it. Hopefully it exists for a long time.
Thank you. I hope so too.
Yeah. I was like, all right, before we jump on in, I always do like a surprise question. And the surprise question is you're about to be interviewed by a psychiatrist. How many psychiatrists have you had to be interviewed by during your life?
That's a good question. And I've actually been, I mean, my first evaluation by a psych was when I was 15 in rehab. Then when I was 22, an inpatient psych. And that's it. Those are my
Okay.
psychiatrist evaluations,
Oh,
which is interesting. So, not too many, but I have to say, I have not found a cool one in person before. So,
yeah, we're very hard to find. So
Mhm.
we try. Some of us try. All right, cool. So let's start off. I wanted to talk to you because again, like I said, you got like millions of social media followers, which is like pretty awesome in and of its own self. And one of the things that like again, your online name is the Truth Doctor, and you've been very transparent, very honest about like your own life, your own mental health journey, and your kind of diagnosis journey.
Yeah.
And you've had some recent kind of developments that have been like, huh, this is interesting. And I've seen this like clinically on my end, right? I'm seeing so many women, right, who are like 40s, 50s. I'm not going to make you say how old you are, but who are like, older-ish, right? Not our typical like 3, 4, 5-year-olds that are getting evaluated for autism.
Yeah.
And, the question is kind of raising up ADHD and autism, right?
Mhm.
I think maybe I have ADHD. I think maybe I have autism. I read some stuff. I saw some stuff online. Can I come on in for an evaluation? And we do these evaluations, and it's like, yeah, you probably do. And it becomes this kind of like life changing, eye opening, additional lens
Yeah.
into it. So I was like, from somebody like you, I'll let you kind of go through your story, and you hear the whole story of like, I had this diagnosis when I was younger, this diagnosis when I was younger, this diagnosis,
Yeah.
multiple diagnoses, and you become very disenfranchised with the mental health system, psychiatry system as a whole. How is it like being on the inside of it and then going through the journey?
I think I have. I mean, being a clinician,
Yeah.
I know, I mean, I'm not a diagnostician, but I am a
Hmm.
clinician. And so like what I do know is that diagnosing is really difficult. I mean,
Yeah.
when you get to actual medical diagnosis, it can be even more difficult because of the variables. But when it comes to mental health, I think the main thing I've realized through my not misdiagnosis, but missed diagnoses, um, is that it really depends on the lens through which the provider is seeing you.
Hmm.
And if they are seeing you as a whole human with various systems, and if they're assessing what each of those systems are and how they're affecting you, versus some clinicians or psychiatrists, even that very high level assume, even though they went to medical school, that the majority of human behavior is psychological.
Yeah.
And so they're placing, for example, personality disorders, which may or may not be accurate, and missing further evaluation to see if there's more stuff going on.
Hmm. Yeah, we see this all the time. And I remember back from like my training in adult psychiatry training, it's like you see the borderline name on there, right? On the chart. And you're like, ugh,
Right,
it is a groan, right? And everyone's like, oh no, the borderline is here.
right.
And it becomes this, you've automatically gone in already with this like idea of like what's going to happen and how this is going to play out. And we'll see you next time and et cetera, et cetera, et cetera. How did you kind of, I guess, tell us a little bit about maybe starting how you got that diagnosis or maybe what was your timeline, I guess?
Sure.
Sure.
So growing up, I lived in a household with a grandfather who drank a lot of beer. My father wasn't around, he did a lot of substances, and I felt like the world was so overwhelming.
Hmm.
Everything was so overwhelming, and it made me really angry, really young. I had a lot of like outward aggressive behaviors, screaming, yelling. I had a difficult time forming relationships with people. The world didn't make sense to me. None of the systems, why people did what they did, acted the way that they did. I had a
Hmm.
lot of questions,
Yeah.
and none of those questions had answers. And one of my biggest questions was then, how can I just make all of this go away? And I found substances through my environment, information, but also just through exploration and
Hmm.
peers. So I started using substances when I was a teenager. I ended up in rehab at 15 for meth and psychedelics. And then I met my now husband, who I've been with since then, since I was 15. And we moved out, went to college together. I was still engaging in all my behaviors. I was in a relationship, but actively unfaithful. There were really clear signs that I had borderline personality disorder, and I didn't
Hmm.
have anyone around me to tell me what that was and to help me through it. When I was 22, so about 7 years into my like really intense symptoms,
Yeah.
um, I got an ultimatum from that boyfriend, now husband at the time, and he said, "This is too much. I have been with you for 7 years and
Yeah.
you are highly intoxicated right now and on a bunch of drugs. I know you are. You're saying that you're not, but you are. And you need to go to a psych stabilization unit or a detoxification unit now." And I was like, "Nah, I went to rehab when I was 15. It was like such a sham. Like, this shit's not going to help me."
Yeah.
And he said, "Well, then I'm going to walk." And I was like, "Well, you're the best thing that's ever happened to me." Sometimes ultimatums don't work, but it did. I
Hmm.
went, I admitted myself to the inpatient. I was there 7 to 10 days, something like that. And that's where I received the borderline diagnosis at 22.
Yeah. What was that like? What did that diagnosis open up for you? Or maybe not open up for you?
Well, at the time, I was on a break from getting my master or from getting my bachelor's in
Hmm.
psychology. So I didn't know much, compared to having a doctorate in clinical psych now.
Right.
So getting that diagnosis, I was also very out of the mental health world. It was just me, my substances, my husband, and the people I partied with.
Yeah.
So I wasn't aware of the stigma. I wasn't aware of the way clinicians or doctors thought about this disorder. And so I had a very similar reaction that some people have to other mental health diagnoses, like, oh, now there's a label for what I'm experiencing, and let's see if there's something that I can do about it. I do have to say that although my healing journey did start when I was 22, which was 13, 14 years ago
Hmm.
now, as much as it was the start, I had a lot of work to do at that
Uh-huh.
time.
Yeah. And then like we hear kind of like similar to what you're describing is that again, from one point of view, there's like, oh, personality disorder diagnoses are terrible, they're judgmental. But then there's the alternative, opposite side, where people are like, they explain what's going on for me. And they, again, like kind of what you're saying, they put a name or a label to what I'm going through and experience to make me feel that like I'm not alone in this, that this isn't just like a me thing, right?
Yeah, am I allowed to cuss on here?
Yeah, of course.
Okay, I find myself like limiting and I'm like, do I need
No,
to
no,
be like,
no. We can
okay,
say fucking shit, so it's okay.
perfect fucking shit.
Yeah,
Um, interestingly, I was ready to start changing my life at 22. So that's when I
yeah,
went to go get my bachelor's and I
yeah.
slowly started finding my way in the mental health field. And it was there that I realized that there was stigma against
Hmm.
borderline. It wasn't the general public and it wasn't society. It was literally licensed professionals that
Yeah,
I was applying to jobs for, that were my colleagues. And that's where I was hearing this conversation. I didn't know it was stigmatized until clinicians showed that to me.
yeah. What did you
I'm
make
like,
of that?
wow, what the
Yeah,
fuck?
yeah. So what the fuck is the right reaction? I guess like what else did you kind of make of it, or what did you think of that, or did you have like moments where you're like, hey, I have borderline personality disorder, and what are you talking about?
So I haven't done that.
Uh-huh.
When I've actually had like interactions with people,
Yeah.
um, probably because I know I'm borderline and I don't want to get into that with those people. Because like I will lose my shit. I can pull the
Hmm.
lever now instead of it pulling itself, and I
Hmm.
just don't want to get to that point. But I think really the more I have learned and experienced the stigma, it's just made me even more determined to do what it is that I'm doing as an entrepreneur.
Yeah.
Everything from the way I run my business monetarily to the way I train my staff clinically, everything has to do with my own personal experiences as both a clinician and a patient and a human.
Yeah.
So the stigma really is my fuel to make change.
Hmm. Good. Yeah. I mean, it's stigma is such this huge thing within the field, about the field, within the field. Everything is stigma within the mental health world.
Yeah.
And it's bad because, there's so many times where ourselves, right, like our clinicians need help in something, right? Whether it's substances, whether it's depression, whether it's anxiety. And we see this so many times, like in my work, I see plenty of like healthcare providers, mental health professionals, etc., that are coming to me for like alcohol stuff, opioid stuff. And it's like, they have to go through it with private lenses because they're not able to kind of go
Yeah,
through it like publicly,
totally.
because there's so much again stigma and legislation and stuff against it. They're held to such higher standards, right?
Yeah.
Okay. So how then? So you had 22, right? You started your clinician work and stuff. How was your recovery journey, I guess, afterwards and with substances? So we'll talk about that right now, I guess.
Yeah, so I was sober for a few years,
Hmm.
from 22 onward. Through that time, I finished my bachelor's, signed up for my master's at USC, moved to LA, started working at a treatment center in Malibu, and then I stopped being sober when I
Hmm.
started working in treatment. And the reason for that was I truly believe, and I've shown that through my behaviors over the last 13 years, that I was not addicted to substances. I was addicted to numbing the sensations in my body. And
Yeah.
so I've like seriously worked on that enough to where I can use and drink casually. And I can make decisions if I want to go hard for a weekend too. My body's capable of doing that. And so it's interesting, this journey that I've been on with
Yeah.
substances. On podcasts, I'm like, I have been addicted. I haven't. I don't know like the language to use. It's all a
Yeah.
label. But I've been through what I've been through. I've done what I've done, and I do things differently now.
Yeah. I always I just had I'm a harm reductionist, right?
Hmm.
And we take that approach to substance use, and it's all in the behaviors that go along with it, right? And any kind of we've normalized alcohol use, right?
Right.
It's become extremely. I mean, it's not even just normalized; it's like promoted, and it's an expectation essentially in America. That like, and a lot of most of the world too. It's like you have to be drinking, right? You want to become like a CEO of your company, or like you want to advance up the corporate ladder, like you have to go out for drinks. Like it's just part of the deal. And when we look at like the statistics of stuff, it's like, what's the substance that causes the most healthcare problems in the world? It's alcohol,
Right.
far and away, right? We look at like opioids, and everyone's talking opioid epidemic and blah blah blah, and it's like when you really look at the numbers, economic values, and Mr. Work and everything, it's alcohol.
Totally.
It destroys it. It's like not even a competition. You have to put down like a different graph or different chart.
Yeah.
But again, so it's an interesting question. Again, also when I work with people too, is like when the question about like returning to use, right? When they when,
Hmm.
when they get back to it, and like what brings you to it, and just that better,
Yeah.
that mindset, right?
Exactly. Yeah,
Yeah,
I mean, I work in addiction treatment, and so it's such an interesting position for me to be in as the owner of a center, because the majority of centers are, I mean, every center is abstinence while you're there,
right,
just
right.
can you get help if you're under the influence.
Yeah,
But a lot of centers are, we are going to give you an aftercare plan for remaining sober for the rest of your life.
right.
The amount of people, like there's a reason that the relapse rate or the recidivism rate is 60 to 80% of
Yeah,
people who successfully graduate from
yeah,
treatment. And it's because, sure, I successfully graduated. I wanted to be sober during this time, but I wasn't given an actual game plan for what choices I'm actually going to make. Maybe long term sobriety is my best bet, but I'm not going to do that. So I'm going to agree to your aftercare plan, and then I'm going to bounce and not
yeah,
actually take care of myself. And so, being the provider that I am, I really do pride myself on being able to train my staff and say, you need to just give them a safe plan that's realistic, that they can actually adhere to and stay in the least amount of harm possible.
yeah. It's just being real, right?
Yeah.
And it's being the real, being authentic, and just being able to say like, I mean, I know I had a patient earlier today that I was talking to a teen, and some substances were coming up, and I was just like, I'm not telling you to never drink again in your life. I'm not telling you to never smoke or to never experiment with stuff again in your life. I was like, but right now, understand that like it's having an impact, and just to be aware of like what the impact is,
Absolutely.
and then
Oh
we
my
can
God.
decide what we
Yeah.
want to do.
The
Yeah,
youth, it would be so much more difficult too, because it's like you really do want them to be reducing use or not using because of how much they're developing and how
yeah,
vital the time period is.
hmm,
But yeah, it's a tough conversation because their whole environment is people experimenting, and they don't know quite enough about consequences in life, how their body really works, and it's
yeah,
harder.
yeah. It's definitely a fun fun world, because they know more than us. So
Right.
because we're not cool enough, we don't know any of that stuff. But
I remember being young, and I believe that. I'm like, these adults don't know shit. And now I'm an adult. I'm like, I swear to God, I do. I'm a kid too still, like I have all those same experiences.
yeah, it's not like we forgot about that stuff, right? So
Right. Right.
um cool, cool. So that was there. Then like what was like the next stop in the journey, I guess?
Yeah, well, so I completed my bachelor's, applied for
Hmm,
my master's at USC, started working in Malibu.
hmm.
I started working in treatment as an overnight technician from 11 p.m. to 7 in the morning, counting medications by pushing them with a pen because you couldn't touch them. And that
Yeah.
was my introduction into the space. And I did that. I worked at this place in Malibu for 4 years. And through those 4 years, I was promoted probably like 6 times before I even had my master's. I was running the clinical department of a 60-bed Malibu treatment center at
Oh, nice.
24 years old, pre master's degree completion. And I realized that the people that I liked the most at that center were the people who were providing the type of care that was really human based.
Hmm.
So the higher I got up, the more I saw things I didn't like. And so I was 26 years old, And I said, if I can do this for someone else, I can do this for myself, and I can do it in the way that I want to do it.
Yeah.
So it was 4 years into my recovery, 4 years into the field, 4 years into my education, and I poached some of the staff that I thought would be best, and I gave them partnerships in the business, and we opened up our first center in Santa Barbara in 2017 when I was, 26.
How'd that go?
Amazing.
Yeah.
It went amazing. It was so successful, so heart-based.
Hmm.
It was all I heard almost consistently, with the exception of, the outlier client or staff member here and there, was, this is the best place I've ever worked. It's the best treatment center I've ever been to. And that isn't to say, best, highest quality clinical or medical care. It was, we see you. This
Yeah.
feels like home. I feel comfortable. I feel like a human. And I was really, really, really proud of that. And I did that. And in between that is when I started social media.
Yeah. How much of a difference, we'll get to social media in a little bit, but how much of a difference do you see? Because this is like the struggle that I'm in, right? At times, right? Part of my work is I do private practice with adults, and then I do work with like a hospital-based system, so a bigger hospital-based system. So I'm, work for myself and I work for the man, right?
Mhm.
And then my frustrations working for the man is always like I have to serve many masters, right? Um, what's my billing? What's my RVUs? Is my documentation is okay? Is my compliance okay? Am I doing this and that and that? Like, when we're trying to do the right thing, is there a paperwork or is there a workflow
Mm,
for this kind of stuff? Right. Like, so I was half jokingly say, I was like, this is why I'm going to quit that job eventually, is because like, I'm sick of doing the paperwork or checking the boxes or not doing the right thing because
mm,
X, Y, and Z is getting in the way.
yeah.
How much of a difference does it make for you when you can be your own boss and do your own thing and have success?
This is a great question. And no one's
Right.
ever asked me this question. And I love the comparison that you made of like working for yourself or working for the man. And essentially, the question is, what do you do when you are the man?
Yeah.
And I mean, I think, I made this video a couple days ago where I was kind of
Hmm.
talking to myself about the night before the first day of the center. And
Yeah.
there was something that I said to myself where I said, people like you can show people that people like you can do it right. What did I mean by that? What I meant was that you can have all of the policies, the procedures, the protocols, the paperwork, the documentation, the standards, and still do it however the fuck you want to do it
Yeah.
within ethical and legal guidelines. And I
Of course.
think
Yeah.
that a lot of people don't think that you can do that because they don't see it done. And that's really what part of my mission is like, you can, and we should, and we have to, because right now what we have are people at the top who
Yeah.
create the protocols and then they bounce. And they don't care if those protocols are helpful for the people or not helpful for the people. When
Right.
you have someone at the top that stays and puts the policies and procedures in place and watches if it's efficient, if it's effective, or do you have measurement based outcomes? And how is it going? And how is your staff doing with documentation? And can we shorten it? Should we lengthen it? The freedom to work within the system, because we're forced to, the system is the way that it is. The
Yeah.
freedom to work how you need to in the system is the best way to change it. Completely
Yeah.
going against it or removing yourself from it, that works for some people. If everyone did that, the system would always stay and it would always stay the same. So, my ideal, actually, my plan when I'm in my 40s, after all these centers are open with our 5 year plan, is to start doing consulting and get people who want to pull out of the system and kind of develop their own system and really help them do that. Like
Yeah.
create centers everywhere that merge the two things that you just described as separate, because they pretty much are in the country and we need to change that.
Yeah. And it becomes so much where like it's not the clinicians that are in charge and making decisions about stuff. And it's
Exactly.
never, and ultimately, ideally, right? Clinicians have the
Yeah.
patient's interest at heart. And when it's not, right, when it's the CEO or what's it called, whatever those people are, like MBAs and stuff like that, like
Exactly.
it gets
Like, you
out of
don't
that.
get it.
Yeah,
Like,
they
you
don't get
don't
it.
get it. Yeah,
Yeah,
like, you see numbers on a spreadsheet,
yeah,
but you don't remember that those numbers are 30 days of a human being's treatment.
yeah,
Like, if you forget that, then get out of the field.
right, right. Which is ultimately, I would say, it's like that's when I'm going to get out of there. It's like when it stops becoming
Yeah,
this, right? When it just becomes numbers instead of people. So
exactly.
good, good, good. I may have to give you a call in a little bit, but we'll see.
Yeah, sure.
um, what then? Okay, so then diagnosing wise, so we'll come back to that. So ADHD and autism, tell us about that then. How did that come about? Or was there anything
Yeah,
else in between?
no, that's all.
Okay.
I mean, I said, like, I knew I
Yeah.
had generalized anxiety disorder and
Yeah.
probably dysthymia, but I think those were all rooted, those were all just symptoms that could fall under that
Yeah.
category, but were a
Yeah.
result of these other disorders.
Yeah.
So I ran my center for 4 years. I developed social media in that time and got on TikTok, started learning actually. There's two sections I know the least about in the DSM. One of them is neurodevelopmental disorders.
Yeah.
Um, I don't even, and one of them is that. And so that obviously encompasses ADHD and
Yeah.
autism. And so when I was learning more about it on TikTok, like the rest of the world, I was like, wait, like this sounds so familiar, but there's absolutely no way
Yeah.
that I'm autistic. And for anyone listening or seeing me right now, you're like, there's no way she is. Look at her. She's expressive. She's communicative. All these things. I also thought that. I grew up with an uncle with severe autism in my
Mm,
house my entire childhood. So it's not like I'm blind to different ways it can show up, but I was blind to different ways that it could show up.
right.
So I had my child, my son, and he was 3 years old. So this was 2 years ago. And his teacher recommended that I get an OT for him and look to see if he may be neurodivergent. And I thought, oh, I don't need an OT. Now I know, okay, he is, I am too. Like, that's what's happening here. I need to learn more about it. I need to go get an assessment. And so
Yeah.
I signed up for a wait list in 2021 to be diagnosed, to be assessed for autism. It took a year and a half. So within that time, I thought, maybe it's not autism because I was still really blinded to the perspective of my uncle and how it
Yeah.
typically presents in men or in young boys. So I did ADHD. I did a test. I was diagnosed with ADHD. I did two separate assessments to make sure. But the final diagnostician told me, well, one, I don't think you have borderline. I think you only have ADHD. And I said, you know what? I have borderline. Let me fucking tell you. But I said, thank you for the justification and the confirmation that I no longer meet criteria because you're right. I don't meet
Right.
5 out of the 9. And I'm not I say I don't have borderline personality disorder anymore. I have borderline personality because I just am who I am, but it doesn't fuck up my life or other people's at this point.
Right. Right.
So I got the ADHD diagnosis. They told me I wasn't borderline, even though I was. And I really did a lot of research and a lot of introspection. Do these two labels cover everything I experience in my life?
Hmm.
The answer was no. There was nothing to justify the extreme sensitivities that I felt in my body, to justify my lack of like understanding how people interact socially.
Hmm.
Um, many other things that we maybe can get into.
Yeah.
So then after, I called that wait list, I'm like, it has been a year and a half. I am a therapist and I
Yeah.
own the facility. Like, this is messed up. You need to tell me what's going on. This is completely unreasonable. They said,
Yeah.
we don't see your name on the list. I said, "Oh, really? Like, that's so messed up. Like, how many other people have you done this to? And I
So
have
many.
so
Yeah.
many more means, and I
Yeah.
can take care of myself in the meantime." So I finally found a psychologist in my area who was willing to assess me, and she had only given out 30 to 40 diagnoses of autism her entire career. So I felt
Yeah.
very confident that she was like very rigid and strict on her diagnoses.
Right.
Ultimately got the diagnosis after interviews with my husband and my mother, and that was in February of 2023, so a year
About
ago.
a year. Yeah. What were those things? So I mean, you had said there were a couple things that you were with other people that you were not noticing or picking up on? What were some of those, I guess, for people who may be listening that maybe like something feels off? What were some of those symptoms, I guess, signs, symptoms?
Yeah. Well, I think one thing that's really interesting is that a major symptom of borderline
Hmm.
is like outward angry outbursts and like
Yeah.
inability to just like be chill. Like it's
Yeah.
just like we can't be chill unless that chillness will get us ABC. Um, when I started looking into autism, I learned that people that are autistic can have really intense, like emotional outbursts also, but for two very separate reasons. And so
Yeah.
I usually give this example because it gives people a lot of insight into how they need to do more analysis. And so obviously I was impulsive, chaotic, wild, disrespectful, etc. Um, but the borderline symptoms were always rooted in interpersonal difficulties, like someone I felt hurt by
Yeah.
someone.
Yeah.
But then what was with my reactions when I was just so overwhelmed in my body? Like that was the main problem. It was that the tag in my shirt had been bothering me for the last 6 hours, that my socks were too tight on my toes, that the
Yeah.
temperature was too hot, the lights were too bright. And so I had to do a lot of reflection of like what is within these behaviors. And I realized I am so wildly sensitive.
Hmm.
I'm so hyper aware and hyper vigilant, which is why I usually just thought it was from my traumatic past or it was my anxiety. But the hypervigilance more so is that my brain must know, see, absorb, integrate every little piece of what I see in my life.
Right.
And there's no time to do that. And so it caused the anxiety and it caused the overwhelm and then the upset if I'm interrupted. And so long story short, I am extremely sensitive. I cannot avoid what my brain wants to pay attention to in terms of sensory sensitivities. And I have a really difficult time seeing people as full entities. Like,
Hmm.
I mean, I call them all humans, but it's because
Yeah.
I see them in all their human parts. And so I'm very system based. I see everything visually, spider webs, everything is connected. And that causes so much anxiety. It causes perfectionism. It causes delayed goal directed behavior. Like it's fucking actually insane
Yeah.
like how autistic I actually am and how that has been so incredibly debilitating for me. And I thought it was so many other things, but also I think it is the reason why I can do everything that I can do. And I mean, I still have so much to learn about it, but those were really the two main things: interpersonal and body sensitivity.
Yeah. And then you had mentioned, well, what was it like then? So you get this diagnosis and it's like, aha, we have a whole new label. We have this whole new way of looking at the world, I guess,
Mhm.
right? What was that like? What was your reaction to it as a whole?
You know, people probably would have thought that the reaction that I had to my autism diagnosis is the reaction that I would have had to my borderline diagnosis.
Hmm.
My borderline diagnosis made me feel like there was a label that would help me. And my autism diagnosis scared me so much I became suicidal.
Really?
And
Yeah.
the reason for that is, well, okay, so a year ago, I was trying to open up the treatment center I'm sitting in now. Obviously,
Yeah.
I just said I became suicidal, so I couldn't. I closed it
Yeah.
down. So I was also doing IVF at the time to have my second child. So in February of last year, I was severely traumatized from doing in vitro shots. I was trying to open up my business and I was newly diagnosed as autistic. Um, it was so overwhelming for me to feel like, one, I'm trying to process and look at everything in my life from a new lens.
Yeah.
And also, I actually felt like I was truly healing my borderline, and I was. And I felt like with the autism, I am the way that I am. It kind of makes me emotional. It's like, I
Yeah.
am this sensitive. This is the way I think. This is the
Yeah.
way I perceive. And there is no changing that. And it was so overwhelming. And I got to a point where, because I was traumatized and overwhelmed, I was fighting more with my husband,
Hmm.
give or take, you know. And there was one argument that we got into, and I said something like, "When are you going to stop judging me?"
Yeah.
And I'm a human. I know humans, we're going to judge. We always do. It's how we
Always,
keep
yeah,
ourselves safe. And
yeah.
so, and I was writing my book at the time, Your Unconscious is Showing, and my husband was helping me with it to a degree. And I had just written the section on the fact that humans judge and always will. And this fucking guy, he was so mad at me, right? And so I'm like, when are you going to stop judging me? I'm bawling. I'm having a complete autistic meltdown.
Yeah.
And he goes, I will always judge you, Courtney. And he was being an asshole. And we've come far past that and talked about it a lot. And I really hurt him in the past. So sometimes when he's mad at me, he's like, I'm going to be mean to you back.
All right.
Um, but it hit me with a ton of bricks when he said that, because it was like, what is causing our problem right now? It isn't going to change. And I'm judging myself. And that's why it hurt so bad. And we were at a beach parking lot when he said that. And that's when I became actively suicidal. And my plan was to walk onto PCH and end my life while I was 3 months pregnant.
Hmm.
And it was horrible.
Yeah.
And I thought, and I was pregnant.
Yeah.
I felt so much in my body at the time. And I realized, like, oh, this isn't anxiety. This isn't just me spending too much time introspecting or feeling. This is being autistic and pregnant.
Right.
And it is so incredibly overwhelming sensorily. So the first year, I'm still in the first year of my diagnosis. I'm in
Yeah.
postpartum. My business is still opening. I mean, it's about to open. But so I have not had time to process this diagnosis,
Yeah.
all while processing it every second of my life, because now I know every sensation is an autistic sensation. So it's very overwhelming.
Thank you for sharing. I mean, obviously, we are all glad, I think, that you're still here, right?
Thank
That you're here with us. But like, I think it was what you're saying from there about like, the borderline, you can, again, like kind of like what you're saying is work through that. And you can say, I'm no longer meeting criteria for this,
Yeah,
right? But the autism, right? Like you can't no longer meet criteria for that in a way, right? That's
completely. I
there,
mean, and
right?
they have autism spectrum
Hmm.
disorder, and
Yeah.
I recently saw a study that specifically called it autism spectrum conditions, and I loved
Hmm.
that, because
Yeah.
being autistic in itself is not a disorder.
Yeah. Yeah.
And so I know I can get to a place where, like, I have noise canceling headphones now. I choose not to go to places if I don't have the things that I need. And
Yeah.
it's good to, having that information makes it easier to live my life.
Yeah.
And yeah, at the same time, it's like, oh, these are going to be accommodations that I need for the rest of my life. I mean, of course, our sensitivities change as we age, but
Sure.
I
Yeah.
think, you know, seeing all the autistic creators that are openly sharing their lived experience, learning more about the research and how
Hmm.
life expectancy is shorter for people that are autistic, and having my own experience over the years, it's like, for example, with borderline people usually tend to get better over time.
Yeah.
With autism, at least with the sensitivities, it kind of seems like it gets worse. It gets harder to function, it gets harder to stay stable, and it gets harder to, like, just live your life without being wildly disabled. And I think that that's part of it for me, is that I've always been go, 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 do
Yeah.
everything you can. And I've
Yeah.
realized now that, like, I'm just working on accepting that this is a disability. And my biggest upset there is that I just want to help people.
Yeah.
And I feel like I'm needing more and more help over time, which is limiting my ability to do that. And that's the primary fear.
Yeah. I always work when I'm working with like my kiddos, my teen patients, and I was like one of the few times I give like advice, right? Because we're not supposed to give advice as clinicians, right? Um, but I always kind of say is like, asking for help is, you know, the one thing in my life that made my life better,
Hmm.
right? And I think it's something we all kind of struggle with, right? Again, as when we're young, and even when we're like not so young, right? We all think we can do everything, but like, that asking for help is so, so, so necessary. And I think when we're have other stuff, right? Neurodivergence, etc., like asking for help is a big ask.
Yeah,
Yeah.
certainly.
So let's talk about we'll do the social media a bit. So how did that come up? So you started doing the social media, but then it blew up, right?
Yeah.
Like
Well,
life changing blow up,
yeah,
right?
I mean, yeah, everything's super different, and I
Yeah.
wasn't trying to do that at all. So in the beginning of 2019, when I still owned my center, my first
Hmm.
one, my husband was publicly arrested in the middle of an intoxicated PTSD episode.
Hmm.
And my baby was born. He was 10 weeks at the time. And my husband was home with him. And it was so overwhelming. They called crisis negotiators, the SWAT team, canines, blocked
Oh
off
wow.
the streets,
Yeah.
called the news stations. It was really, really, really traumatizing. It
Yeah.
was in January of 2019, which was the year I was finishing my doctorate, becoming an LCSW officially, and celebrating the second year of my business as an addiction treatment center owner. And the police broadcasted my husband's mugshot to the email list that they had and put it on the news.
Hmm.
That was really hard for me. As someone who
Yeah.
struggles with a sense of self and identity, I didn't know how to show up in the world after that at all. I didn't know how to walk into my office, walk on the sidewalk in the city I was in. It was so overwhelming, and I felt ashamed to be a human.
Yeah.
And I said, I did not get into this field to succumb to the stigma, to succumb to being a statistic. And so I said, the best way that I know how to handle my pain is to turn my pain into purpose. So I'm going to start a social media account because I recently started following this account called The Holistic Psychologist, and she has a little over 1 million followers only at the time back in 2019. And I think I can grow as big as her, and I have a message to share too.
Hmm.
So I was like, what should I call myself? And me and my husband, came up with the name that I can't help but tell the truth. And being autistic says a lot about that too now. I literally cannot help it. It doesn't make
Yeah.
sense to me to do it any other way.
Yeah.
Called myself the Truth Doctor, started on Instagram, was berated by my cousin to get on TikTok for 3 months, refused, finally got on there, and I was the personality that people were looking for to
Yeah.
help them with their mental health. Blew up to 1 million in 7 months.
How, I mean, obviously that's again, like I've talked to a few people who've had like huge changes from this stuff, right? Like it just changes everything,
Yeah.
right? So now you're further. I mean, your life is on full exposure now, right? To an extent, right? But
Yeah.
controlled exposure, right?
Yeah.
Um, opportunities show up, and then all kinds of opportunities show up. Um, how were you handling all that?
I love it.
Yeah.
I feel like, you know, the things that I'm allowed to say on platforms where you would think those things cannot be said
Hmm.
means so much to me. Like to be able to speak to audiences that people like me otherwise wouldn't be able to speak to, and to give
Yeah.
my perspective on people like me and on our field. It I really think that it's changing people,
Hmm.
and it's really difficult. So I have like a very quick story that I think
Yeah. Yeah.
is kind of interesting. And I just found out this just
Yeah.
happened on a podcast interview that I did last week.
Yeah.
So I think it was 2021 or 2022, I went to Coachella
Yeah.
and I started posting a bunch of pictures of myself while I was there. I mean, even like I was like wore a thong, and like it was like I had like a full on outfit, but like it was a thong and then like a sheer thing. And I was like, did
Yeah.
you know therapists have butts? It was like just I was like ridiculous. It was like
Yeah.
it was a little too much. But that weekend, I received a DM from someone. Someone had asked me, "What is your niche? What kind of clients do you treat?" I answered that question in an Instagram story. Someone DM'd me and said, you are not a clinician anymore. You sold your first business 6 months ago. You don't have any clients. Who do you think you are to even come on here and say that you have a niche? Like, you're so embarrassing. Ever
Hmm.
since you became a content creator, like, you're just embarrassing. Like, you have sold out.
Yeah.
I was like, fuck off. But also, I was like, it affected me
Yeah.
because, and I realized that it was partly because I had sold my business.
Yeah.
I wasn't seeing clients at the time. And so, like, I had to sit with it for a little while. Last week, and I swear to God, I've like thought about it every week since then. And now I'm
Yeah.
opening practice and I'm like, I got my. But
Let them know.
last
Yeah.
week, last week, I had a podcast interview, and a therapist who owns a 12 clinician group practice in Canada said the reason that she started her group practice and trusted herself that she could do it was because she was at Coachella the same weekend as me, and she was embarrassed to post anything on her professional channels about the fact that she was at Coachella because she would think that she'd be perceived as unprofessional. She
Yeah.
saw my posts, put her Coachella pictures on her website, her therapy website, had so much traffic that within, I think, a year or 2 years, she now has 12 clinicians underneath her, and they
Yeah.
all do a human first philosophy. And it all stems from that one weekend where, I mean, I think I lost like 5,000 followers because they're like, oh my God, she's so unprofessional. But I
Right.
also, how many lives have I now changed that this one therapist took a chance on herself?
Yeah.
So it's been like a really wild journey. And as much as I've had media and society, like benefits and projects, the best thing for me is internally is managing how to be in relation with so many different people around the world and get
Yeah.
so much feedback. But it's also to be able to be in relation with so many people around the world and provide feedback and encouragement. That's the best part for me and the hardest.
Yeah. I mean, I think it's so necessary, especially with, we're trying to destigmatize mental health, right? And, the biggest kind of conception around mental health was like it was a stuffy old white boys, all white men's club, right? And it was a secret society behind closed doors and glasses and smoke and pipes and blah blah blah. And it's like now we're doing things differently. And I think, you were one of the first when I started doing my TikTok a little while ago, like you were one of the first people that I was like following on there. And I was like, oh wow, we can like do this stuff. We can say these things and like it's okay. And like the people who are gonna like say like, oh my God, you're unprofessional, like, maybe they weren't in it for the right reasons or they're not being authentic about themselves or ourselves, whatever it may be. And like
Yeah.
that's okay. Right? That they're not gonna be following us or they're not gonna be okay with us, right?
Well, totally. And
Yeah.
I saw this quote the other day that said, if you are wrong for 99% of
Mhm.
people in the world, then you are still right for 1%, and that's 75 million people.
Yeah.
So can there be various types of clinicians? Can there be various types of clinics?
Yeah.
Yes, and
There
there
has to
very
be.
much fucking
Yeah.
should be. Yeah,
Yeah, there
exactly.
has to be. It's necessary. So because I think like what we've seen is that like the standard quo has not worked for so many people.
Mhm. Like, hello, like, let's look at our outcomes. Like,
Yeah.
why are we getting more people in line when, like, we're literally unsuccessful so much of the time? Like, we need
Yeah.
to be doing things differently, and we know why. We know why things shouldn't change according to the top, and we know why they must change according bottom up.
Yeah. Cool. I know we're like wrapping up almost a little bit. So I know like we'll try to touch one more topic, I guess. So IVF, you've talked about IVF. How was that experience for you in pregnancy and babying and all that stuff? You're babying a couple things, you got your clinic and your babies too.
Yeah. Yeah, both times that I was opening up clinics, I did
Yeah.
IVF and got pregnant at the same time. The first time it was very easy, and that's what
Hmm.
I mean. I mean, of course, every pregnancy is different,
Yeah.
but the first pregnancy, I wasn't so overwhelmed sensorily. I had no morning sickness. It was great.
Yeah.
And I think maybe IVF for me isn't such in general, an overwhelming or like emotional process because I'm not the one that suffers from infertility. It's my husband.
Mm.
And so I know that just like for so many women, it's like such a scary process. For me, it was
Yeah.
like, I kind of like knew that I would get pregnant because I'm a very fertile person and I know that.
Yeah.
So like that wasn't really a concern for me. But my second round of IVF, I think it's just, I'm older and I'm really sensitive and it was one of the most traumatizing things I've ever been through in my life. And I will not do it again. I am done having children. I can't do it. I can't do it.
Yeah. It's, like I've had some experience with it, like, our own personal stuff. My sister has had stuff as well. I mean, it's different obviously on the guy side, but still it's a couple thing going through it.
Yeah.
Um, but it's very, very hard. I mean, it is people, there's, was it the ruling just came out of
Oh
Alabama
my.
that, which is just like disgusting, and
Hmm.
like, signs that the world is going to hell, America's going to hell, all this stuff. But like, it's people don't realize, right? People don't realize like what IVF is,
Yeah.
what they have to go through, that it's not just like, oh, we're picking and choosing stuff, or like it
Right.
is these or like people just can't have sex, or like
Yeah.
it's stupid shit that people are just saying
I
that
really don't get it.
have no idea what it is. Like again, like, I had, for people who may be listening, like I had health issues that resulted in us having to kind of go alternative routes after we had our three regular ways.
Mhm.
you know but that was part of it, right? Is just because there's so many reasons why people could have to go down this route.
Right. Yeah.
um so okay, I know we both got stuff to do in a little bit, but um what last questions, I guess, what is your self-care? What do you do for self-care?
Hmm. I am horrible at taking care of myself. Um, I mean, honestly,
Yeah.
I used to just not eat at all,
Mm,
like, because I would forget. Or, I'm the type of person, like, I can hold my bladder all day long. If I'm focused, like, I can literally, hyper
yeah.
zoom work. Now that we know my diagnosis and that I have, interoception issues, it's either too much or not enough. My husband packs my lunch every day. Today, he packed me a peanut butter jelly sandwich, a string cheese.
Classic. Yeah.
And so, I actually take care of myself by doing whatever I need to do to set up systems to get my basic needs met.
Yeah.
And then what I've been working on recently is just stretching to like
Yeah.
help myself somatically. And, I had a whole plan. I'm going to stretch, then I'm going to do yoga, then Pilates, then I'm going to run, and then I'm going to do a marathon. And my plan was to really do different things in increasing intensity every month this year. And I'm still stretching because it gives my mind, I feel like I'm stretching my mind too.
Hmm.
And so meeting my basic needs, stretching my body. And then what I'm really trying to do for myself is something that has caused me a lot of damage based on my childhood attachment issues, which is when I develop a place of work, I am one to put the employees and the clients first. And that's not okay for me. They need to be equal because if I put them first, then I am working every moment of the day. I'm not eating, I'm not sleeping, I'm
Yeah.
not. So what I've been doing recently is like really watching myself and trying to determine why am I making decisions that I'm making in the business and how is this going to expend my energy? Because I don't want to get to a place where I did with my other treatment center, where for the benefit of the center, I had to sell it because the way I describe it is my trauma built that business. And
Yeah.
I am not interested in my trauma building this one. Mm.
We're trying to move past it, right?
Yes.
Try not to forget it, but like, learn and move from it. So
Yeah.
cool. You've got a book coming out. What's your book about?
My
Tell us
book is
about your
called,
book.
yes, thank you for asking.
Yeah.
Pre-orders should be sometime in the summer, which I'm really excited about. It's called Your Unconscious is Showing. And what it's kind of battling is the whole um, you act the way that you act because you're traumatized kind of thing. And, I did this behavior subconsciously, and I'm trying to change the rhetoric, the semantics to be unconscious instead of subconscious, because subconscious only refers to the mind.
Yeah.
Unconscious, you can look at things like how we cognitively make decisions, literally how our brain itself makes choices, how our body influences the development of our thoughts. And so how we feel is what we think. And really getting people, like, I'm trying to pull out of the pathology of this field and honestly look at it more in like an organic medical way where it's like you're simply a human with multiple parts that are out of your control, automatic and unconscious, and you need to learn what those are and stop saying everyone's just a narcissist and traumatized. Like, we make quick judgments, we
Yep.
make automatic thoughts. And so that's what the book is about. It's saying I have spent my whole fucking life now knowing I'm autistic. It makes a lot of sense seeing right through people
Yeah.
and realizing that most people do not see themselves or other people that way. And if they did, we would understand we are far more the same than we are different, and also so different that we all need to get to know one another.
Good. I will pre-order it when it comes on out. So
Thank
very much looking forward to reading stuff. So how can people follow along if they're not? I mean, I'd be surprised if they're not already following along with you, but
you. You can learn more about me at my website, thetruthdoctor.com. If you are interested in learning more about my center, you can go to existcenters.com. And my socials are at the.truth.doctor on TikTok, YouTube, and Instagram.
all right. Dr. Courtney Tracy, thank you so much for being truthful, honest, and open with us. I very much appreciate our time together. And like I said, I will be probably reaching out to you at some point in time when you've got your consulting gig up. So,
I would love to help. Thank you so much for the interview.
all right, we'll see you.
Thanks for listening to this episode of Psychiatry Unboxed with the Kicks Shrink. Please make sure to like and follow and subscribe to the show for all the latest episodes and interviews. As a reminder, this episode is not intended to be used as medical advice. Please make sure to consult a healthcare professional regarding any healthcare decisions for yourself or loved ones. Until next time, be well and stay informed, and keep rocking those kicks.